We talk about AI, it seems, on an almost daily basis, but then I came across this story and I thought, wow, you talk about what AI can actually do and where it might cause change and radical change in that case. And medicine is one of those things, and that's understandable. But the thing that I'd never heard of before, and I'm thinking this is a first, doctors report the first pregnancy using a new AI procedure. So I wanted to try to understand what this was all about because obviously this would seem a big breakthrough. Dr. Chris Labos is on the line, cardiologist with a degree in epidemiology. He's a regular here on CJAD, of course. And Chris, the story here, and as I said, this would have relatively large implications, right? Because the couple in this particular story had gone through 15 rounds of IVF. No luck. They've been trying to get pregnant for 19 years, and suddenly along comes AI. What happened here?
Well, essentially what the AI was doing was that it was allowing clinicians to actually identify healthy sperm. So rather than a human being looking at sperm under the microscope, they were able to use AI to identify the healthy sperm, which they then used in the IVF cycle. So I think this is an interesting example of how AI is actually useful in medicine. I mean, you hear a lot of hype and you hear a lot of people making some, fairly outlandish claims about artificial intelligence. But I think what AI is very good at, it's very good at doing repetitive pattern recognition tasks that humans are actually not that good at. And looking at a large sample of a specimen under the microscope is something that AI can do quite well, whether it's looking at X-ray images or CT scan images, or in this case, microscope slides of a semen analysis.
So in this case, if I read the story right, when you talk about humans versus AI in this particular case, they talk about 8 million images that the system using AI can scan in about an hour, which is truly incredible. And I know they also had a system here where they wanted to compare, didn't they, with people, for example, embryologists who study this kind of stuff to see how they would do it, and it wasn't even close.
Yeah, I give you an example. Think of your calculator, right? I mean, you can do long division and your calculator can do long division, but your calculator can do it much more efficiently and much more quickly than you can. So your calculator isn't smarter than you, it's not better than you, but it's very good at doing very, very straightforward things in a very, very short period of time. So it can analyze a lot of images very, very quickly as opposed to a human being that has to look at them one at a time.
So in this particular case, I mean, what does this mean for couples going forward? I mean, is this the kind of thing we can now look to and say that this is a brand new discovery and this will work for everyone, or what are the limits here?
Well, we have to understand what it's actually doing. It was very, very good at identifying healthy male sperm, right, in a sperm sample. So for all the other causes of infertility, this isn't actually really relevant. And I think that's the sort of lesson here with artificial intelligence. It's going to be very, very good at very, very specific things in the same way that your calculator makes it easier for you to do math problems in math class. But it's not going to solve the problem of infertility. It's not going to fix the underlying issues. It's just going to make one particular task a little bit more straightforward and a little bit easier. And, it's unfortunately going to replace something that used to be done by a human being. Rather than having a technician looking at all those microscope slides, now it's going to be AI software on the computer, but it's only going to be useful for those specific circumstances where it's very, very hard to identify healthy sperm in a male sample. For a normal sperm, it's going to be a very, very straightforward thing. You won't even need this technology at all, but it's going to be very, very useful for very difficult cases where it was very, very time-consuming to identify a healthy enough sperm that you could test for IVF.
How often is this the case for people who can't get pregnant, this particular problem that AI solved here?
Infertility is often, there's a lot of different reasons why people suffer from infertility. More often than not, there's multiple problems at once. It's not just the woman's fault or the man's fault. It's often both people's fault. And it's rare that, there are obviously some men that have azoospermia, meaning that they have no sperm or very, very, few sperm. More often than not, you have some female issues, you have some male issues. Men may have a lower than normal sperm count, but not an abnormal sperm count. They may have some issues with regard to the quality of the sperm, but not necessarily that the sperm are completely dead. So how often is this going to be useful? It's really debatable. For those very severe cases with men who have virtually no sperm that can be detected visually, maybe you'll be able to actually find some using a technology. The issue here, though, is that there's the alternative or the solution in these circumstances used to be using a sperm donor. But for obvious reason, most people don't want to use a sperm donor. They want to have their own biological children, right? So this is going to give people an option, a potential alternative to having to use a sperm donor if they can identify sort of enough healthy sperm to try an IVF cycle and potentially have a successful pregnancy.
So can I just ask, with respect to this particular case, and as you describe it, yes, it only affects this particular issue as far as sperm is concerned. Is there hope here in terms of AI being used, as I said off the top, in different areas in medicine, that in fact it can help solve problems that right now we're unable to solve?
I think it can. I think what AI is going to be very, very useful for, it's probably not going to. It's probably going to be evolutionary rather than revolutionary. So I think AI is going to become very good at note taking. So improving documentation. So freeing up physicians, instead of spending your days writing notes, the AI is going to generate the note for you. It's going to be very good at cycling through all the X-ray images. It's going to be very good at looking through all the hundreds of electrocardiograms that were done in the hospital in a given day and flag the ones that are abnormal. So it's going to be very, very good for those repetitive tasks. So is it going to cure diseases? It depends how you want to look at it. It's going to help treat patients. It's going to help automate some of the more repetitive stuff. And it's going to be potentially useful in new ways, like, speeding up the process of finding healthy sperm for an fertile couple so they can try, another IVF cycle. So it's going to be that sort of thing. It's actually going to be truly significant, but in some ways it's actually going to be a lot more boring and banal than I think many people actually realize.
Yeah. All right, Chris, I thank you so much. I really appreciate your time today. Thanks.
My pleasure. You take care.